Hello, my name is Kirsten Mackay. I'm a consultant rheumatologist. I'm based near Torquay in South Devon in the UK, and that means I'm about 25 miles from Exeter and the same for Plymouth. And I've been there for the last 20 years. I think that's a very good question. I've been thinking about this, and I think it's a combination of two things I like most. One is people, and the other is cutting edge science. And it brings those two things together perfectly. And I've never regretted my decision to do it. Rheumatology is that perfect combination of you get to know people over a long period of time, because the vast majority of people I meet and make a diagnosis and treatment plan for, I look after for many years. The second thing, it's definitely cutting edge science, because a lot of it is about immunology. And I've had the privilege of, in my consulting career, working throughout the new range of fantastic medications that have started to become available, called biologic therapies. And when I first became a consultant in the year 2001, they were not available. And by the end of that first year, they were. And I have followed that progress throughout my consulting career, and it's absolutely revolutionized things. When I was training in rheumatology, I used to look after about 75 beds of inpatients of people with really severe rheumatoid arthritis and things. And in the last 15, 20 years of my consulting career, because of these brilliant drugs, I have only had to admit 5 people, which is just amazing. So that's been the main reason. It's been an excellent choice for me. It covers everything from joints to the immune system to hearts, lungs, everything you could care to mention, it covers. The other thing I really enjoy doing is a very practical subject. So I can make such a difference for people who have just a simple inflamed joint by injecting it. And I really enjoy doing that. And everybody says I'm very good at it. I always think one of the best things to do is add painless injections, what you need to do that works. I think it's that combination of getting to know people for over a long period of time, getting to know the story, and that delight in problem solving, listening very hard to what the problem is, working out a diagnosis and therefore a treatment plan, and seeing the positive outcomes of instituting that treatment and getting them well again. It's got to be the aim of being a doctor, I think. I think what they tell me is I'm good at listening. I'm good at thinking of them as a whole person, not just a bunch of joints. I do thoroughly enjoy knowing the story and learning about things and getting a good treatment plan. And also working out that difference between if the first plan doesn't work, what's the next plan? Always having something else in reserve. And what I like about them is that privilege of knowing them. When I meet them, they're in a difficult place, and it's hard to share and very difficult to ask somebody for help. That was quite a privilege to be allowed to do that. And the outcomes of seeing them get well is just a delight. I've thought about that, and I have two. The first one, the mantra, is listen hard, explain simply, but fully, and painless joint injections. My catchphrase is there's always a plan B.